Today is Wellness Wednesday, and this morning we are joined in studio by Dr. Tarek Pacha, a board-certified urologist at Memorial Healthcare in Owosso. Good morning. Thank you for coming in.
Good morning, Matt. Thanks for having me.
Yeah, good to see you. So let's talk about the different types of urological conditions that you typically see and treat.
Urology is a specialty, Matt. Primarily deals with the kidneys, the bladder, and the prostate. Typically with the kidneys, we deal with kidney cancer, kidney stones. With the bladder, we deal with things like recurrent urinary tract infections, overactive bladder, going to the bathroom a lot, incontinence, when you lose urine involuntarily, and prostate's the big one, for men. Enlarged prostate that makes us go to the bathroom quite a bit, and prostate cancer, which is the most common cancer in men.
Yeah, so really, kind of a variety of things that you see there. Kind of dive into some of the different treatment options that you provide.
Sure. I mean, I think, urology is quite a large specialty. I thought we'd maybe focus on kidney stones, and kidney stones is quite a important condition in urology. It's very painful, but not only is it painful, it actually can be lethal with regards to infection and causing a blood infection and so forth. It's very important to understand kidney stones and what they could imply. Typically, when you have a kidney stone, or you think you may be having a kidney stone, the classic pain in the back, but not always. It can come in as nausea, vomiting, flu-like symptoms, COVID-like symptoms, can all present as a kidney stone or like a kidney stone. And interestingly enough, it can even present as urinary tract infections, frequently going to the bathroom and not necessarily having all that pain. So kidney stones has a very wide presentation, but it's very important to understand because they're very painful and they can be, not to be fear-mongering, can be life-threatening.
Sure, no, I mean, you have to take things seriously and listen to your body, so all the more important to seek out a professional like yourself. So speaking of kidney stones, how are you able to remove kidney stones now without a cut or an incision? Talk about how treatments come along.
Perceptive question, exactly. The treatment for kidney stones have been incredible. It's just unbelievable. We used to have to make these big incisions, hospital stay for a few weeks. Now we can go without a single cut or incision with a special scope. Believe it or not, I can slither my way all the way up to the kidney with scopes. Relatively painless. Of course, they're asleep during the operation, but relatively quick recovery. And, we get it before it becomes a problem. No cuts or incisions. It's quite amazing with lasers and baskets and all kind of neat things.
Yeah, so bottom line, folks really shouldn't be intimidated because it's come such a long way.
Absolutely.
Yeah, and then, finally, overall, why is it important too? I mean, you mentioned that you could possibly have a bad outcome there, but overall, why is it so important to have them treated, period?
100%. Kidney stones, again, pain, obvious. When we have pain, we're unable to be our best selves. And then the fact of the matter is, it's very disruptive to your life. I mean,
it impacts a lot of people too.
Good question. 1 in 10 people, and it's actually increasing. And the reasons are many. I don't know if we have enough time to go into it, but it is very important to deal with it, like you just said, that it can lead to life-threatening situations and a great disruption to your family life, to your work life, and to your overall wellness.
Well, you're in good hands, though, if you have to be treated for that.
Much appreciated, thank you.
Yeah, for much more information about urology healthcare options at Memorial Healthcare, you can visit memorialhealthcare.org, or you can call that number that you see there on your screen. It is 989-720-CARE if you have any questions. Thanks so much for coming in this morning. We appreciate your insight.
Well, I appreciate the opportunity, Matt.
Yeah, good to see you.